Hi, my name's Izzy. I'm a fourth year medical student. I'm currently completing my Setting Up Courses SSM with Mr. Sumi Abdul at Delta. My presentation today is going to be on how to get into obstetrics and gynaecology. So this slide is essentially just outlining the different areas we'll go over in the presentation today. So we'll start with an overview of the specialty. We'll look at the job role and what that might entail. We'll look at the medical training pathway from medical school through until consultancy. And then we'll look at ways in which you can demonstrate commitment to the speciality in your portfolio and also what the specialist training years might entail. So this is just to give you an overview of obstetrics and gynaecology as a specialty. So it's both a medical and surgical specialty, which means that you will have more medical roles, but you can also go to theatre, perform surgery, etc. A lot of professionals work across both parts of the specialty, but some do specialise, and you can also further subspecialise in later years of your training pathway. And this is something that I'll talk a bit more about later on. Just to differentiate between obstetrics and gynaecology. So obstetrics is looking mainly at pregnancy and childbirth, fetal medicine and fetal health, fertility and subfertility. And in contrast, gynaecology is looking at the health of female reproductive organs, and it does so before, during, and after the reproductive years. Just to caveat, this slide is not discussing really the pros and cons of a career in obs and gynae, but more just giving you a summary of what the specialty entails. So this slide is discussing the job role itself. It's more just to give you some examples of things that obs and gynae doctors might do in their day. As I mentioned earlier, it's a very varied and wide specialty. So the specific tasks would be dependent on what area you might be focused in and also whereabouts on the training pathway you are. So an ST1 day versus a consultant day could be very, very different. The specialty is really varied, and as we mentioned before, covers obviously the obstetric component and the gynaecology component, and that's a vast number of pathologies that you could be seeing day to day. And in addition, it covers both acute conditions, so things like an ectopic pregnancy or maybe an emergency cesarean, but also chronic conditions, so helping patients with long-term symptom management and improving their quality of life. Examples would include things such as PCOS, endometriosis, and obviously many more. As with any medical specialty, you will be working with an MDT, and in this case, it's a very diverse team. So you could be working with nurses, the neonatal team, anaesthetics, paediatrics, midwives, ACPs, PAs, and there's a lot more that I haven't named here, but just to give some examples. The box at the bottom is just to give you some examples of day-to-day activities. So things like attending ward rounds. This would be for your inpatients. You might also be attending outpatient and community setting clinics. You could be performing scans, attending theatre and performing surgery, running specialist clinics. You could be involved in public health. So, for example, you could be involved in rolling out a different vaccination program. We can think about things like the HPV vaccine program as an example. Often there'll be on-call or out-of-hours shifts as well, and then demand for these are increasing. And then other tasks are things such as teaching, so it could be medical students or it could be specialty trainees, doing audits, clinical governance projects, attending meetings, and you might even be involved in some sort of medico-legal cases too. So this slide is essentially outlining the medical training pathway specifically for obs and gynae. So we start at medical school, you do your undergraduate or your graduate entry medical degree, and then once you've passed your final exams, you move on to your foundation training. So this will be your FY1 and your FY2 year. When you come towards the end of your FY2 year, it's probably when you start thinking about applications for specialty training. There are two ways you can essentially join the obs and gynae training pathway. So if you know during foundation training that obs and gynae is a specialty that you want to go forwards with, you would apply for specialty training directly with obs and gynae. And that would mean you'd be able to do it as a run-through program. So you'd start in ST1, you'd run all the way through until ST7, without needing to reapply. In contrast, if someone coming towards the end of their F2 year is maybe unsure of what specialty they want to go into, or potentially chooses another specialty, they may do their training program for that. So, for example, they may go forwards with internal medical training or core surgical training, or they may do an entirely different run-through program. And then after a period of time, so for example, after completing IMT or core surgical training, someone may decide that they want to then go forwards with obs and gynae. So at this point, they would apply for higher specialty training and they would join the pathway at ST3. So just to clarify what I mean there, you can either go through the program as a run through, so straight from ST1 through to ST7 from foundation training, or you can go into a different specialty or do your IMT or core surgical training and then apply for obs and gynae as a higher specialty training pathway, and you would join at ST3. So now just to talk through what happens when you join the specialty training program. So if you're starting with ST1 and 2, you would run through these 2 years of basic training, and then you would need to take your Part 1 MRCOG. And this is to be registered as an obs and gynae consultant. So you take Part 1, you need to successfully pass it to move into ST3 to 5 training. You will then complete this, if successful, and this is known as your intermediate training phase. And then once you've completed ST5, you would take Part 2 of your MRCOG. Now, once you've got Part 1 and Part 2 completed, you then get a certificate of completion of training. And then you complete your ST6 and 7 years, which is your advanced training. And then after that, you would be able to apply for your consultancy post. So this slide is just to give a bit more information about getting onto the specialty training program as an FY2. So we've obviously already discussed about it being a run-through program. There's a few things to think about in the next 2 points, just if you're kind of preparing to apply. So there are 2 requirements. So one is that you need to have your advanced life support, and this needs to be before starting as an ST1. So sounds small, but just something important to make sure that you've got, and when you apply, they can see it there, especially as it's a prerequisite. And the other thing is that you need to have 18 months or less experience in obs and gynae. So for example, if you were wanting to take an F3 year and try and get some more experience or more things to put on your portfolio, just make sure that you don't accumulate more than 18 months of experience in the speciality. Just to caveat that by saying any rotations that you might have within obs and gynae whilst you're doing your foundation training, they don't count towards this. And then in terms of the 3 elements that they might be looking at when you're applying for your ST1 training. So first and foremost is your portfolio. That's something that's spoken about quite frequently, and I'm sure you all know what your portfolio is. But if you did want any further information on sort of obtaining points for your portfolio, definitely go and check out that video on Delta. It's really helpful. The second part is an overall interview score, and that's made up of 2 components. The first being the MRSA examination. Other specialties use this, for example, psychiatry and GP do as well. And your score in this accounts for 25% of your overall score. Then you do a 3-station interview, and your marks from this account for 75% of your overall score. Your overall score is then used in a ranking process to decide who gets into the specialty training program. One important thing to just note here is that the top 75 ranked applicants based on their total MRSA score will not need to attend an interview to be eligible for an ST1 offer. So just to clarify what I mean there, if you do your MRSA examination and you are ranked within the top 75 of the people applying, then you do not need to do an interview to be able to apply for ST1 obs and gynae. Another thing just to touch on, I know it's been spoken about a lot, and the competition ratios are increasing, unfortunately. The 2025 competition ratio for obs and gynae was 16.65, so approximately 17 applications to 1 successful application. So the competition ratio is really high. And and therefore it's important to try and think about building your portfolio and doing things that you can do whilst you're at medical school to give yourself the best possible chances. So part of the portfolio is showing commitment to your specialty. So I've just created a couple of slides to look at some ways in which you might want to do that as a student, and then also we'll discuss it as a foundation doctor too. And some of these things can actually contribute to other areas of your portfolio as well. So definitely worth thinking about. Just to start with, so thinking about medical school society. So obviously you could join an Obs and Gynae society. And even better, if you can get a role on committee, this can show leadership as well, so it can contribute to two elements. You can opt for SSMs or electives in Obs and Gynae. Attend conferences, so the Royal College of Obs and Gynae hold quite a few. They do vary in price, but just make sure that when you're checking out the price, you select that you're a student, because there often are reductions in price. And sometimes some of them are free as well. I've at the end listed some useful resources, and one of those links gives a full list of loads of different conferences, so you can have a look on there for some suitable ones. You can register with the Royal College or also the BSOG, which is the British Undergraduate Society of Obs and Gynae, so that could be quite helpful. Attending careers fair, the Royal College do run one, and it is actually free. It's online, and they have loads of different workshops and talks, including some on how to tailor your CV to the specialty you're interested in. So that's very helpful. Also, whilst you're on placement, medical school placement, SSMs, electives, all of those things, try and take as many opportunities as you can to ask the registrars or the consultants if they've got any audits going on, any clinical governance projects, any case studies that they're writing up. And just see if they need any support with those. It's really helpful to them because it takes some of the work off their shoulders, and it also gives you an opportunity to publish something and to use it in your portfolio. So try and take those opportunities whilst you can. Not all universities do an intercalation year, but for those that do, if you already know you're interested in Obs and Gynae, it's definitely worth thinking if you can capitalise on this and make it focused to the specialty. And finally, thinking about prizes and awards. So the Royal College, again, offer quite a few. I've linked this at the end in the resources section, but they include things like financial rewards for doing or financial support, for overseas electives or even national electives. There are awards for really good case study submissions. Some of these are specific to medical students, and some are only open to foundation doctors or ST1 trainees, but it's definitely worth having a look at them and seeing what you can maybe apply for. So this slide is also talking about how you can show commitment to your specialty, but maybe looking at things that are a bit more specific to your foundation year's training. So obviously, if you know that this is something that you want to do before applying for foundation training, you can rank jobs that have an Obs and Gynae rotation higher to try and get one in your list of rotations. Unfortunately, this doesn't always happen, but that doesn't mean that you can't do things to give you more experience in the area. So reaching out to the Obs and Gynae department at the hospital you are placed at and seeing if you can do any shadowing or any work with the ward whilst you're there. There's also a Women's Health Foundation module that you can do. It's not a GMC approved curriculum, and it's intended really for self-directed learning. But you can essentially look at a list of different deliverables and outcomes that are expected of you to improve your knowledge within women's health. Some of which include things like how to take a gynaecological history, how to take an obstetric history, performing pelvic examinations, speculum examinations. And you can get some of these as supervised events, so signed off, so things like DOPS, mini-KEXs and CBD, so you can record them in learning areas. And this is also going to obviously bolster your commitment to specialty. Registration, similar to what I mentioned in the previous slide. And then obviously, if you're thinking about taking some time between F2 and specialty training, you could look at doing your clinical fellowship or some F3 locum work within Obs and Gynae. Again, just making sure it doesn't exceed that 18-month limitation. I've linked the Royal College person specification at the end. I definitely recommend taking some time to have a look at it. It means that you can tailor your portfolio to the things that they're essentially looking for. In foundation years, you also get a taste a week. So again, if you don't manage to get an obs and gynae rotation, this could be a great opportunity to spend some time there. And finally, similarly to the slide before, have a look at the prizes and awards on the Royal College website. There are some that are specific to foundation year doctors as well, so definitely worth having a look at. So this slide is just to give a little bit more information about the specialty training years. So obviously we just sort of discussed earlier in terms of running through from ST1 to ST5 and completing part 1 and part 2 of your MRCOG. And we also mentioned that this would then give you your CCT to enable working as a consultant. There are options during this specialty training period to partake in higher academic qualifications. So things like PhDs, MDs, but it's not necessarily a requirement. And one thing I didn't talk about earlier was that during your ST6 and 7 years, you can sort of subspecialise. So you can do this anytime after you pass part 2 of your MRCOG. You can start to think about whether you want to subspecialise. And the core subspecialties I've popped on the screen, but consist of urogynecology, gynecological cancers, maternal and fetal medicine, and reproductive medicine. In order to subspecialise, you need to do 2 years of clinical training and 1 year in research. And then things to consider about this is if you have a higher academic degree, so if you've already done one during your earlier years of training, or you've got relevant publications, some of that can count towards that 1 year in research. So just something to think about if you're in ST1, ST2, 3, 4, or 5, and you think, I actually might want to subspecialise in this area, it could be worth thinking about doing some research beforehand, and it might reduce that time taken to qualify in that subspecialty. So we're just summarising here what's been discussed in the presentation. So to start with, we've spoken about how obs and gynae is a very varied medical career. You can have medical and surgical involvement. You could be seeing acute and chronic patients, and you could also be based in inpatient and outpatient settings. This list of different varieties is not exhaustive, but it's just to give a flavour of what the specialty is like and what it covers. Obs and gynae covers female reproductive health across the entire lifespan, alongside pregnancy, fertility, fetal health, and childbirth. Female and women's health is being focused on a lot more within healthcare. There's a big push to improve healthcare provisions and involve females more in research, which means that obs and gynae has a lot of scope for research opportunities if this is something that's interesting to you. It's a run-through programme if you go from F2, so you would run through from ST1 to ST7 and then consultancy. And in order to sort of expose yourself to the specialty, build your portfolio and enhance your chances of getting onto specialty training, you can start doing things even in medical school. And there's so many different options for you to help give yourself the best possible chances. So I've just listed some useful resources here. I have discussed a few of them earlier on in the presentation, but just to kind of highlight the ones that I maybe haven't mentioned. So there is a website so the Royal College actually have provided summaries and reviews from consultants within different subspecialties. So it could be quite interesting to have a look at that and see if any of those subspecialties might be of specific interest to you. Underneath that, I've linked the GMC core curriculum for obs and gynae. So again, something to have a look at and see whether the curriculum is of interest to you. And then further down, I've linked an article that was written by an ST1 outlining a day in the life, but actually it was listed as a week in the life. So I think that gives quite a nice flavour of the different things that you might be doing. And also further highlights my point earlier that it's very difficult to do a specific day in the life because it's so varied, and a week in the life gives a better sort of interpretation of that. And finally, at the very bottom, I've popped in the link to that Women's Health Foundation module I discussed. It shows the curriculum and the different deliverables that are expected during the foundation module, which could be quite interesting to have a look at. So this is the last slide of my presentation. It's just a list of the references I've used throughout, in addition to the resources on the previous slide. They were all really helpful websites and articles that give a really good overview of the specialty itself, the training pathway, and things that you can be doing both in medical school and as a foundation doctor to improve the likelihood of you getting onto specialty training. So I would definitely recommend having a read if it's something of interest to you. I hope that this presentation has been helpful and that it's given you a bit more insight into the specialty, and it's given you some ideas of things that you can do to help boost your portfolio and your chances of success. Thank you very much for listening.